Today we're going to be doing an implant on number 14 on Dr. Johnston here. He had a root canal and a crown on this tooth for many years, and it finally broke and ultimately had to be extracted. Today we're going to place the implant in the bone, doing it fully guided with our new system from BioHorizons. And then the plan is to leave the implant alone and let it heal for about 3 months, and then we'll finally put the crown on there for you. So we're going to go ahead and get the area numb. It's the most important step for patient comfort. Okay. All right, so this is just kind of a walkthrough of how we got our surgical guide made for Dr. Johnston's implant case. We took a digital scan with our CEREC scanner, and then we took a 3D CT scan with our CT machine, and we sent both of those things to an implant planning service up in Idaho. And this is actually the report that they send us back. This is them walking us through kind of their suggested plan, and what the implant could look like. So we review this video in depth, and then we consult with the planner there to make any changes that are necessary. And then about 5 days later, we end up with a fully guided surgical guide that helps us get the implants right where they need to go. All right, so I'm just gonna poke around and make sure everything's good and nothing's bothering you, right? So then we verify that our surgical guide fits. Shit fits perfect. We're using our tissue punch to punch through the tissue so that we can access the bone. All right. Maybe I should use more technical terms, huh? So now we're going to start our osteotomy. Osteotomy is a fancy word for hole in the bone that the implant will later go in. All right. Okay. We'll get that out. We're going to place our implant. So this is the implant. This is our drive key. Screw that onto there. Alright, so then we place the implant through the guide.
It's like Doc's getting old.
Beautiful. This is just a protective covering that covers the implant while it heals. All right. Major advantages of guided surgery is that you can do the entire procedure flapless. So we just have a small hole punched through the gums, and that's our implant sitting there. So we're just taking a 2D digital x-ray just for a quick check on the position of the implant. So you can kind of see our implant here. Granted, this is in 2 dimensions, but right about here is the floor of the sinus, and then right about here, obviously, is where the bone, is around the teeth. So we just drilled straight through here. So we'll get a CT, and the CT tells all. So we'll see if we did good there. So we're just wanting to see a nice wall of bone on all three sides of our implant here. We're right up against the floor of the sinus. We have good a millimeter and a half of bone on both sides, buccal and lingually, just like the plan said it would. So, really happy with this result. I think it's going to do great. If you are missing any teeth and are scared about implants or worried that we may not be able to get the implant where it needs to go, we have a solution for that. So give us a call, Johnston Murphy Dental Care, 318-255-6780. Thank you. God bless.